Hi guys, welcome back to my channel. Now before we get started, please can I ask that you subscribe to the channel. We've got some awesome content coming up. I don't want you to miss out. These points that we're discussing are showing up all the time in clinical practice. So I'm trying to get this information out so that people all across the world like yourselves can put this information to good use with your dog. As a physiotherapist, my job is to look at the area where the injury is and also consider complications elsewhere in the body that can arise as a result of weakness or an injury to a certain area. So in this case, we have injury to the stifles, which are the canine knee, and I'm going to talk you through some areas to watch for if you have a dog at home that has any pathology in their knee, osteoarthritis, cruciate issues. There's going to be two areas and two muscle groups that are really important for you to keep an eye on, and I'm going to talk you through some tips and tricks on how to reduce pain in those areas and keep your dog moving comfortably. So in this video, I'm discussing some things about a beautiful bulldog called Roxy. Now, Roxy fractured one of her legs when she was a young dog, and unfortunately, she's been diagnosed with cruciate disease. Cruciate issues are a really common source of pain and lameness in the rear limb of dogs. As a physiotherapist and with all my clients, I perform lots of movement examinations, also called gait assessments. But what I'm looking for is how well a dog is moving, if they have lameness, which indicates pain, or if they have any alterations in their movement pattern, which might indicate problems, injuries, or soreness in their body. When we looked at Roxy, she did a characteristic bunny hopping action when she ran. So the two main muscle groups that I want to focus on in Roxy's case, but will be relevant to many other dogs out there, are the hip flexors and the gluteals. Here I'm showing Roxy's owner how to palpate or locate her hip flexor muscle group. It's quite a small muscle, it's quite deep, it attaches at the front of the pelvis and goes all the way to the underneath of the lumbar spine. So it's not the easiest muscle to find, but you'll see here I'm directing Roxy's owner as to the region where the muscle lies and showing him the right amount of pressure. You can see Roxy is showing some signs of distress, so we had to reduce our pressure. There was some licking of the lips, she looked away and she had an anxious look on her face. That told us, and that was indicating pain in the muscle, so we had to reduce our pressure. And you will also see me directing Roxy's owner into the gluteal muscle region. Here are some massage tips to help you. Alternate between each area. First and second fingers release the hip flexor. Thumb goes in circular movements over the gluteals. Talk to your dog. These are painful muscles to work on. Aim for 10 seconds in each area and repeat 5 times. Slowly build up time spent working on these muscles. So I hope you've learned a couple of things from this video. The main things I want to get across are relevant muscle groups with this type of disease in dogs, hip flexors and gluteals, how to find them, how to massage them, and how to understand the relevance of them to your dog's mobility and comfort. I hope you put these tips to good use. Don't forget to subscribe to the channel.